37-year-old female. Okay? She complained of abdominal pain and she's in the restroom. Okay?
Are you sure?
Hello, ma'am.
Hi.
What's the problem today?
I have really bad abdominal
When did that start?
pain. Probably literally yesterday. I don't know, it's kind of weird.
Do you know what time yesterday, roughly?
Maybe lunch-ish.
Okay, and what time is it now?
Modern day. Whatever time it is now.
Okay.
10
All right.
a.m.
Okay.
I'll get some vitals on you, man, okay?
Okay.
You're gonna be able to see this arm here and
has anything made it better or worse?
pain.
No, it
Okay.
is kind of coming and going. I don't really understand.
Okay. Has regular bowel movements and regular poop and pee?
I'm not regular, so it's hard for me to kind of answer that.
Okay. All right. Well, we'll get you going to the hospital. Does that sound like a good plan? We're gonna get some vital signs. We'll get you moving in that direction.
Yeah, I mean, I kind of want to see if I could just drive myself.
Okay.
Maybe I just need help
Well, I think if it's
to my
this,
car.
if it's this severe,
I'm gonna come
then
back in. Okay, I am 190 over 100.
okay.
My
And then-
pulse is 115.
Yeah, I'm tacking. Okay.
My SAT is fine.
Okay.
Okay.
All right. So I really think that if you're in this amount of pain that you shouldn't drive yourself, we should probably drive you because there could be a lot going on that we can't see from here. But we're gonna do a couple things. We'll put you on the monitor and we'll start moving from there. Does that sound good?
Okay.
Is there anything in the toilet?
There is not.
There's nothing in the toilet.
I am literally, I have not, my pants are up, right? Because I knew you guys were coming. I got
Yeah.
myself together, but I have not gone to the restroom.
Well,
Very good question.
All right. So I would get kind of moving, and then then we're gonna get you on the monitor. We're gonna
Okay.
talk about
Do you have all
the
your
possibility
organs?
that you're pregnant. Go through all those types of things.
I feel like I'm gonna puke and
Okay.
I might pass out.
Yeah.
Can you guys put me in one of my friend's cars and they drive me?
No, your vital signs are showing us that your blood pressure is very high. We should really take you in.
For real? Okay. All right.
Do you have all your organs? Never had abdominal surgery for any reason?
Yes, I have.
For what?
I had. Oh fuck! Hold on.
I want to start IV and some.
What's that look like?
Nothing. I'm just dry heaving.
Okay,
Yeah,
Sorry, I can't talk.
Are you in that much pain you can't move
I
right
cannot
now?
move. I'm so
Okay.
sorry.
That's right.
We'll get some pain meds on board
It
first then
hurts
before we move you. How does that
so
sound?
bad. Okay.
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 You allergic to anything?
Sit, bro.
So we start an IV.
How you gonna do it? Where are you gonna do it?
Closest arm to
Yeah, I'm gonna take this right
outside of
here.
the way of throwing up on. Yeah.
You get a chip. You get a card.
The voice.
When your patient's on a backboard, which way do you flip them to make sure for when they vomit? Towards your partner.
What is that? Colon.
The
Okay.
drinks
We
we
give you
got.
some Zofran.
When you get
So you're gonna start an IV here?
Yep.
Okay.
Start an IV.
How much Zofran you gonna give?
4.
Okay.
And then also some pain meds as well. You're not allergic to any?
Okay.
I can make the sound.
Sit, bro. Sit, bro.
Okay.
Okay, how much pain meds and which pain meds?
There's
What do you
not
guys have to play with?
100 fentanyl.
Okay.
Hit you with that.
How much do I weigh?
How much do you weigh, ma'am?
160 this morning.
160. Let's do some math here.
What's your protocol say?
50 and a couple.
Protocol doesn't say 50,
1
25,
microgram
50,
per
100, I
kilogram.
guarantee.
It says 1 microgram per kilogram.
Does it give you 1 to 2 or does it just say 1?
1, 2.
Most protocols say 1 to 2, they give you that little variance.
I'd start on the low end, then we can
But you
repeat
still want to give me 100. Okay. Is that your normal dose, you think, for
Pretty tacky.
your
a
regular
lot of
people?
pain.
Okay.
I would start off there.
Totally fine. You're in practice. It's up to you. Just always remember, you can always give more. You
Yep.
can never take away.
Yep.
Turns out 100 would be wonderful for me. Okay?
Okay.
So you've treated me with 100 and some Zofran, so now I feel like I can kind of stand up a little bit.
Okay.
Okay, but I am very shaky
Yep.
Very
We'll assist
woozy
you stand up,
and-
okay?
and I'm quite pale. You didn't really ask about my skin signs. I know it's hard because, simulation, blah, blah, blah. But when you look in and you come in and you see me, I am
Pretty pale.
kind of pale.
Okay.
I look a little white. Okay? All right, I'm ready.
Just okay?
Oh,
Ooh, I don't want to do too much, okay?
I know, we're gonna get you just down. We got a little down and a little bit forward.
Well, I didn't have my coffee cup in here.
Alright. You need help with the feet?
I can do it, but I want to keep my feet close to me. Is that okay?
Yeah, absolutely.
Seven moves.
Oh, God.
There's no movement.
Well, so put some seatbelts on you too,
I've
okay?
been a little dizzy.
Go ahead and lift your arms up for just a moment.
Like a roller coaster.
Nailed it.
Okay.
Also, like a roller coaster, keep your arms and legs in fact right at all times.
Very good. Oh, I feel very dizzy. Is it okay?
You want to lay more down?
Oh, I'm really still very dizzy. Okay, that's good.
Blood pressure just back cold. You got it.
Feet have dropped now. We're about 130 over 80.
30 over 80.
Yeah.
And where's the abdominal pain located?
You know, I'm starting actually to feel a little bit better. I don't know if it's the medicine.
Where was the pain hurting though prior to?
Like kind of down here.
Down that lower
Like
left
my-
quadrant?
Yeah.
Okay, when I do
Felt
an
better?
abdominal exam, do I see any sort of...
I want you to do it on me. How you would do it.
Yeah.
Tell me what you would do.
So I'm gonna bring your feet down just a little bit. I know it's gonna hurt, but I need to take a look at that abdomen, okay?
Okay.
Look at the seatbelt off.
I like to hold it, okay?
Yep. Alright, I'm gonna try to feel around your abdomen. You tell me if it hurts when I press down, okay? So I have to lift your shirt up too. You want me to do that or?
I can take it underneath my.
Okay. So that actually take a look.
What do you see?
When I see one.
You can literally see something on me. You should be able to.
See some ectopic scars.
Okay.
So you had the surgery then, huh? When was the surgery?
It was 10 years ago.
10 years ago.
Oh, that's a little.
A little painful right there.
Sorry, did you move my hand?
Yeah.
Just for a
Yeah,
second, okay?
just for a sec,
Feels better.
okay?
Oh,
Right there.
Oh, yeah.
Here. Does that pain, does it radiate anywhere?
And now it's changing. The pain is changing. I don't know if you believe me, but
Okay, where's the pain changing to?
okay, got better for a minute, and now it's kind of like all over.
All over?
Yeah.
Okay.
I don't know. It's not as bad as before. It's got to be the pain medicine or something.
Is that helping out a little bit? Okay. And what surgery? Yeah, with the back.
He's running fast.
So.
How are you though? You are.
Always try fast.
So I have to ask, ma'am, have you recently been pregnant at all or anything like that?
Yes.
Okay, you have. When was the last? When did you give birth to your baby?
Oh, I've never given birth.
Oh, you've never given birth
No,
before?
I could be pregnant right now.
Okay, you could be pregnant right now. Have you ever had any sort of? Have you been pregnant in the past at all with any complications?
I've had 2 miscarriages.
2 miscarriages. Does it feel something similar to that?
No.
No. Okay. And you never had any sort of ectopic pregnancies or anything like that?
No, what is that?
It's basically where the egg settles in the fallopian tubes.
Oh shit.
Yeah, it can cause quite severe pain.
No, I've never
You haven't had any sort of vaginal bleeding?
No. Maybe just like, what we call spotting. Very, very little, actually.
Okay,
Now
and
that you say
nothing,
that.
and with that spotting, that you haven't noticed any sort of tissue with that or anything?
What would that look like?
Like clumps of red tissue coming out. Have you noticed anything along those lines?
No. It's kind of like, red, not dark red.
Okay,
Like a little redder.
a little better? Okay.
Like my normal period. Well,
Like
it could
normal
be, I
period?
guess, but I've never had pain like this.
Okay, I gotcha. And do you, when it comes down to your medical history, do you have anything related to your abdomen besides that surgery?
Is she crowning?
Yeah, so. Is this burning me? He hasn't left yet.
He hasn't looked.
Okay, what was the question? Let me answer the question. My surgery. I had an ovarian torsion once,
Okay.
and that's what that surgery scar is.
Okay.
And they had to go in and they were, it was softball size. The cyst was softball size and it damaged my tube, but I kept my tube. So I got everything still.
Okay.
I just had a surgery, and he saved me, but everything is still in there.
Now, do you
Feel the
ever,
same as that.
yeah, does that pain feel similar to that?
Yes.
Okay.
Yes, it does.
Bingo, gringo.
But now, the pain went away and it's kind of changing.
Okay.
And now it feels all over and actually it's coming back. The pain is coming back and the nausea is coming back.
It
And I want to sit up.
So we'll give you some more pain meds.
2 minutes till the hospital ride.
Okay. So every dose probably need about 50 more fentanyl.
Okay.
New vitals have been since I've given you Zofran.
They cycled already.
Oh,
They did?
sweet.
Yeah, it's automatic, 10
Maybe
minutes.
just on the edge. Just on the edge. I guess you can only get Zofran every 15.
15. Yeah.
Max of
Yes.
8.
8. Okay.
Yeah, so every dose
132
on
over
that.
78.
And then let's give you a little lump of fentanyl too as we come in.
Now, someone said redo cycle her vitals.
Yes.
Yes.
When do you want to do that?
We'll do it right now.
5 minutes.
Is this before or after your second administration of fentanyl?
Well, before it actually.
Okay. I'm going to tell you my pressure is now 90 over 50.
Oh, fuck.
I'm looking real pale again.
Oh, shit.
We're gonna get some fluids going.
Can't just get told
So we're getting some fluids on board.
Okay, how much that's for?
Food. 1,000 bag. Hot food. So just titrate to it. The way 500, reassess from there. So,
Okay.
what is your temp? What is your heart rate at?
It's never gone below 100.
Okay, so you
So
feel pretty
I'm
tight
like
the whole
105
time.
right now.
And you're still stabbing fine.
My stats, do you have any anything?
Yeah, we have, no, we don't have an option or anything.
I'm down to 96.
Okay. Okay with that. Okay, so yeah, starting on some fluids, give you a little bit more pain meds, and some more Zofran too.
Okay. With that pressure of 80, you want to get fentanyl?
Oh, you said 80 or you said 90?
90, sorry, 90. You still cool with fentanyl?
Yeah, I'm still good with that.
Are you receiving hospital still okay with that?
Yeah.
Zofran, fentanyl. Fluid, well, we just started it.
Just
We
started.
just started it, so it'll be a minimum, but
Pressure back that shit.
500 is good. You're good.
Why is
I can take it.
it?
500
Sit right there.
will definitely bump up my pressure to something you're a little happier with.
Sweet.
But I'm still pale,
Yeah.
and I'm still becoming more and more tired. Okay? We're at the hospital. Let's do our differentials. How many differentials did you can come up with?
A lot.
A bunch.
So many.
It's abdominal, it's female. So there's potential for like 10. Okay? Let's start with some of the things that you may have ruled out that was on your differential. Did you successfully rule anything in or out? And it's not that we always have to do that, right?
Cardiac.
But we need a nice little differential, and then we start to arrange our top 2 and top 3 ranking. That's going to be our assessment and then ultimately our treatment. So what were you ruling out? Cardiac. You said you're going to put me on monitor. Did anyone follow up to see what I had going on?
Beautiful 12.
Those happen, right? It's not my heart. It's not my heart, so we can rule that out. Where was that in the differential anyway?
Pretty low.
Pretty low. We just let it fall off. Okay? What else?
I wasn't here earlier, but probably age and sexual
Did you
activity.
say AIDS?
Age,
Okay.
age and like sexual
That's good.
activity.
That's a good differential for that one. Age and,
Sexual activity, like.
Yeah.
so all those things are still on the differential list,
I was throwing
right?
in any sort of OB pregnancy stuff in my differential as well as some sort of GI.
Okay.
You have versatile ovarian cyst.
So let's do our differentials. Okay, let's start with number 1. What is your most suspected?
Where?
Ruptured cyst.
Yeah.
Okay, what's number 2? GI issue? Okay.
Well, I'm going with GI bleed too. What was
Okay,
it?
we're gonna come back to all these, so. I think I'm, you know what, is there anyone in the classroom?
Did you have,
Everybody's in there?
you have that link today?
I do.
Yeah, she said it.
I want a board so we can write this stuff down, but
Appendicitis.
can we all remember it?
Yeah.
Okay, so the GI issues, I have all my organs, so appendicitis has gotta be on there.
Did she have her referred pain? Did you have to ask that?
She had left-sided tenderness, which
But-
1% of people have their appendix on the left side, so that was a slim chance.
Yes, no chance.
How many percent? 1%.
Really?
That's almost 1 in 100.
So is that still out there? Okay, do you still want it on the list, just down low?
Way low.
Okay, so Appy's way low, so we're still, are we still dealing with GI?
CCFD should have a left side appendix, right?
Okay, anything else? Yep. Okay,
Let's have two.
okay, okay.
37.
So we got 5 or 6 going on there. Yep, 37. I did say I could be pregnant. Okay.
Congratulations.
So we're happy with those 6. What other assessment tools could you do, could you obtain, like number-wise, to rule out any of those or to rearrange your differentials now, right? Because you have to, there's a reason you're going down that treatment algorithm, right? So what other things do you want to gather from your assessment? Temperature would be wonderful. Can't have that, I guess.
Why not?
Gastric sounds.
Because I don't think that's even what we can use focus for. Temperature is 99. Does that do anything? Does that do anything for you?
No.
Your temperature's 99.
Yeah, 99.
Oh,
Last bowel movements, I'm irregular, but maybe like yesterday. Okay. What else?
What about your pee?
What about it? I have it.
Yeah. Does it burn?
I
Does
weighed
it
it.
hurt?
Does not.
Any color?
Nope.
Any,
So what else?
vaginal discharge?
None. Well, I guess
Yeah,
it's
said,
just
right, you asked.
spotting
No period.
and the big D. Okay, so I don't have that. So what did you add and take away?
And flow. It's not.
Could be a flow, I don't know.
Yeah. It's not, bladder related.
Okay, could it be like PID? Is it reading like PID?
No.
Okay,
No.
because that's more of like a global type pain when it comes to the fever, right?
Little gas.
Okay, so you put it on and then drop it right back off. This is good. Okay, so do we have our core things?
Yeah.
Okay,
See.
so what?
When was
you
your
had to
last
pick
period
one.
flow? Did we ask that?
Didn't?
When was last your period?
8 weeks ago.
Eight effing weeks.
That's what mine.
You just had it. You have one?
Had one.
That sucks. I bet that hurt.
So,
You always had regular menstrual cycles?
nope, I'm a 45 dayer. So that's a good follow-up question. Yes, I do.
Oh, you're so smart.
Yes, I do. What's one thing that may have tipped you off? And if you explored a little bit of my pregnancy journey, right, because you have a little bit more chit-chat time, you're secondary on the way to the hospital. We were doing like IUI, right, so like insemination type stuff, right? So I not only could I be pregnant,
But you're trying.
I'd be pregnant on purpose. I pay people for their goods to be pregnant, right? Comes in a phallic little can, and then my doctor takes it, and then you do all the things. So like, not only is it a possibility, it's an
You're
actual
actively
thing.
trying.
Yeah, actively
You
trying.
could be pregnant
I
and
had
ectopic and
HCGs
like
that says I was
twins
pregnant.
and.
But the one thing we haven't had, and you guys are all men, and I don't know if any of you have children or whatnot, but usually between that 6-week and 8-week mark, once they, realize they're pregnant, if they're not trying, it could be a little bit longer, but we're trying. So we were like, okay, gotta be on the stick, or we gotta do all the things. Between 6 to 8 weeks is when I went for the first ultrasound. And that's when they confirm that it's in the right place. Guess when my appointment was?
Today.
The next fucking day, right? So all those little pieces for you to kind of narrow in. Do you need to narrow in on what's going on with me? You don't. You really don't. But no, you're doing what you needed to be doing, okay? But why was I continuously up and down with my pain and up and down with my power and being erratic with my vitals? Give me all your points. No! I do have a bleed going on, so what's happened? So not only do I have an ectopic, I ruptured. And when did I rupture?
On the
You
toilet.
guys fucking watched
Right there,
me,
yeah.
right? Because all of a sudden I say I feel better. And I did. Like I had like this really weird sense of like electricity, and then I'm like, oh, I'm fine, right? I still look like I'm fucking this color.
Yeah.
I'm not going to go to the hospital, right? So I'm like convincing my friend to turn around. And then all of a sudden I'm like, oh shit, something's going on. So like I lost 500 liters in my belly in like a couple minutes. From the time I felt good, 4 minutes later I'm like, oh, I do not feel good. I
Did
do
they
not
feel
feel
any
good.
rigidity when they were assessing your abdomen?
So he basically said he poked me in 2 places. One place you guys are not obviously gonna do, but he did like a little exam inside the hoo-ha, and he said, if I touch the specific area and you kick me, you're going to surgery. So he went right for here, and he did a very small, but basically it had swooshed out so much that I was in pain everywhere at that point, because basically when I sat in front of the doctor, I had already ruptured. And then, so what he did is that he did that little finger exam, and anytime blood is not where it's supposed to be and it's touching other tissue, it hurts so bad. Like it hurt. Why I didn't want to lay down is because the blood was up and it was touching kind of near my diaphragm area, because it had your stomach doesn't want to hold, it doesn't want to do anything with 500 cc's of blood. So it's like dispersing, and every time it touches something it's not supposed to. Like I almost felt pain up in my shoulder. Like I preferred like a damn screen.
Ultrasound would have been great in this scenario.
Would have been. You have to learn how. You have to have like the titles behind you and all that stuff. Right? They just give us focus like idiots. Like, well, it doesn't look like it should be there.
Yeah.
They staff them with a needle in their chest. Anyway, what was I saying? So he did that little test, and I went into surgery, and then blah blah blah. So super good assessment. You did all the correct questioning. Just remember to gather all your information. What could help rule out something like infection relatively early on? Grab a temperature. Yeah. And I'm sure you guys do this like without thinking. You say, you know, to your partner, you don't even have to say it, right? They're just going to get all the things that you want. They'll do the monitor, they'll do the temp. So that's always good to go. We didn't get a BGL here. Do we care?
No.
Not really. Not really, unless you was covered 100% makeup, right? So just, you look like 105, right? Other questioning overall that we could have done. Because you focused pretty quick. You did your exam. Good.
I was thinking about the organ in that lower left quadrant.
Okay. You're like, what's
Now I'm
there?
starting to think of OE stuff.
So he said check if she's crowning. Is that a real logistic thing that we might need to do?
If you're earning it.
It kind of depends, like, it depends as you go down that list. Like,
Sure.
If you're ruling things out and you're still, then maybe, but they're more than likely if it's not, if you're not pregnant and you're getting thrown out, then
Yeah.
usually get there. Versus if something's taking you down to go fast, it's usually not, oh, they're pregnant and they're crowning, yet
And it
way
was.
over here looking at something else.
He dabbled in that, and then he followed
You
where
said you
my answer
had
was
normal spotting recently too, so that was kind of cluing in on more OE stuff.
Yep. Your treatment, pain medication wise, and all that fun stuff was good. Obviously, once you find out someone is potentially pregnant, you have to be careful with what meds you give them.
Don't want to get ketamine.
That's baby, for sure.
Realize that was a choice.
But fentanyl in that scenario is not going to really.
It's good across the barrier.
It is, but
I mean, there's,
I have to also, you know, protect you and
Pros and cons.
protect the baby.
pros and cons. Pros and cons. If a mother is seizing, pros and cons about the medicine. The baby's not going to really survive if we let someone go into status and stuff like that. So, well, yeah. What else? What did you guys think? Was there anything missing that you guys wanted to know? Were you guys all on the same kind of differential path?
Yeah.
Getting treatment path? Okay. What type of hospital did I have to go to? Somewhere where they have surgery, right? And somewhere where maybe they have OB. You guys forget, you guys bypass and go over now?
We can.
We would not ask.
We went for that.
Yeah.
For like tomorrow.
Okay. Carson Tahoe would be a fine start. That's literally where I went, where I had my surgery.
Oh, good.
Yeah. You just gotta make sure, you know, some of these little podunk hospitals, and I speak from working out in Fallon and Baylor, every once in a while, like all of a sudden, they just like don't have OB.
Yeah.
They just like don't have it. They're like, oh, okay, babies, you know, highway 50 to highway, and they're like, oh, what do you mean you just don't have it? So you just gotta be careful, you know. You guys, I think Carson Tahoe can relatively take everything outside of the trauma, right? And then stabilizing. I needed some blood. I had to get 2 units of blood. It's a lot. Yeah, right? Isn't that crazy? You got another
I
step.
think they have more of a consistent surgery. I mean, for a while.
They fixed the general
Yeah.
surgery, GI still hit and miss.
Yeah.
Like, people in Reno have to be careful now because St. Mary's doesn't have an OB department and stuff,
Yeah.
right? They never had a NICU or a PICU, but now they don't even have
Oh, I didn't realize that.
delivery stuff. So, oh my God. Just gotta stay up on the possible be what. Anything else? Was that a good refresher at least? I mean, just the world of differentials that open up and the more questions you ask, the better, right? But as far as your overall treatment and narrowing down where you were going was wonderful. And you treated me really well, which was good. I appreciate that. Questions, comments, concerns?
Thank you.
Bueno, thank you. Did she give us a time that we're switching? But we're not gonna all start out of there. The last group, I asked if you guys wanted to do as real life scenario as possible, if you have any medics that are still kind of on their probation or they want to do IVs or actually pull up meds. The other group said no, but I am fully willing to take IVs or meds or anything if you guys want to do so.
This guy right here will do it. Hey!
Uh-huh.
Pneumatic.
He's already poked me several times. In a not really good way. Right? That's a rumor. I do. I have the monitor here. Yes, I was wondering if he was going to be here today. Where'd he go?
No, he ain't just credit. Yeah.
Oh. Anyways, he's almost done. What do you guys want to do? Verbalize or do you want to play? Verbal is good? Okay. So this is a real life scenario. I'm going to play your patient. This actually happened to me, and it actually happened literally in this city, just over at the, I don't know, is it like a training center? Law enforcement. It's on the corner of somewhere.
Oh, in the south part of town?
Stewart camp?
Yes, yeah, I think so. So I was there 2 or 3 years ago for CIT training. You guys know what that is? Crisis, very close. Crisis intervention training. Mostly law enforcement based, right? There's a reason for that, but they're incorporating EMS in it these days. You might see that sometime in your near future. As a supervisor at a banner they sent us. It was 5 days a week for 8 hours. This training was the whole day, 8 hours. So I was sitting in this training, and it was by day 4 when I had this medical complaint that you guys are going to work through and help me deal with. Okay, so you are dispatched to 37-year-old female, abdominal pain. She's in the restroom. Okay. And
Hi, what's your name?
hi, Ruth.
Ruth, what's going on?
Oh, I don't know.
Well, can you explain to me what you're feeling?
I have pain down low, and I cannot move now.
Can you point to where the pain is?
I don't want to move, but I'll tell you.
Okay.
It's like right there. Like right there.
Okay. When was your last menstruation?
Oh my gosh. Hey, probably like 8 weeks ago.
8 weeks ago. Okay. My partner here is going to check your vitals, okay? Have you been vomiting?
I want to.
You want to, but you haven't yet?
No, but I really, is there something nearby?
Yeah, we got this trash can right here for you.
Thank you.
When was your last poop?
Oh God. Recent, not very regular, so.
No, okay, but normal for
Oh,
you?
I don't feel good. Hold on. I gotta just kind of go slow.
Okay.
I really can't move.
Have you ever had this pain before?
This exact pain? No, but I have problems.
Have you ever had ovarian cysts or ectopic pregnancies?
Yes, all of the things.
All of the things? Okay, cool. Well, can you stand up and sit down on our gurney that we've got right here?
I don't think so.
You don't think so? Okay, we'll help pick you up and get you on our gurney. How about that?
All right. What kind of medical problems do you have?
Ovarian cysts and ectopic pregnancy sounds like she's got history of. Yeah, oh yeah, totally. Let's get a line going, maybe get some pain medication on board.
All right, now we're going to get our gurney as close as we can. And what we're going to do is we're going to pick you up and move you onto our gurney.
We won't literally pick you up, but we'll pretend that we did.
I'll pick you up.
Can this come with me?
Yeah, we've got a nice vomit bag for you.
Okay.
Okay, what are your skin signs right now?
Super pale.
Super pale. What was your blood pressure?
180/100.
Wow.
And I'm tapping at about 130.
Do you want me to?
Okay.
Satting fine.
Would you like me to pick you up?
Do it.
I'm happy to pick you up.
Because I can't move.
Actually, go fire up the rig.
Okay, dude. I mean, as real as you want, buddy.
She said
Yeah,
pick her up.
yeah. Okay.
You know what I do for a living?
We gotta go.
You drop me. I just have an early vacation.
Yeah, first.
Early retirement.
Right? We're going to go underneath your armpits, okay? Yeah, we're going to go.
I just want to stay in this position, okay?
Yep, can do. You're going to rotate her straight back.
Well, it sounds like her last menstruation was 8 weeks ago. sexually active, history of ovarian cyst, a little bit history of
Kick the feet up as much as we can with our gurney.
Lower left quadrant pain.
Oh, I don't feel good.
Is the pain coming in waves or is it constant?
And Norzer, when you get a chance, place the monitor underneath her feet.
Oh God, it's been constant for the last like half hour, but it's been coming and going for a while.
Any history of kidney stones?
Yes.
Yeah, is it hurting when you pee at all lately?
No.
Okay.
No, I don't like that.
Blood pressure, I mean, coming out of that like postpartum, pericardium one too. I'm like,
Yep,
oh, that's bad.
exactly. You gotta rule out Craig.
Not, well, Greg is at the front of my brain, ectopic pregnancy, front of my brain. Didn't forget this. Greg, what are her other vitals? You got her hypertensive, hypertensive, tachycardic, pale, how's she, oxygen saturation? 100%. Wonderful. Cool, so in the back, we'll get a line going.
Where are we? In time and space.
Time and space?
Like, where are we now?
Oh, we're moving to the end.
Not
We're in
like
the end of
moving
this
section,
speech.
like, we're in the middle. Okay.
Yeah.
Oh, I'm so.
So I'm gonna take a writer for sure. Woz, be my writer. Yeah. Yeah. Concerns with the hypertension.
Are we getting things to me here?
We got IVs. Yeah.
You too.
I've been saying 3 times.
Okay, so where's your line?
Well, I don't want it.
I mean, at the end of the
Yeah,
scenario, you're going
as high as possible.
Okay.
Yeah.
So just one line?
Two.
So hard? You really want to?
By the way,
Okay.
16. Why not? I mean, because right now, like,
I feel like
for
I'm in
differential,
trouble.
I don't like people ask history of pregnancy. I don't think history of ovarian cyst, well, it's extremely painful with ectopic pregnancy. I'm worried about if you have
So
pressure.
1 blue and 1 sticks. So you have 1
Okay.
18 that's good to go.
Okay.
What have you given me so far?
Your 4, we've given you, as long as allergies. Giving you allergies.
So that's what we gotta walk through because you're going so quickly. Cipro. Like what if I just told you my allergies are all pain medications and all nausea medications? I'm dead.
Yeah.
Right? Well, walk me through it slowly.
Yeah.
Cipro. Cipro is my only allergy. Do you know what that is?
Nope.
Okay. Ask the patient. Okay. Like, what does it for? It's an antibiotic I received once.
Oh.
It's ciprofloxacin, right? Yeah. So just ask them. It's no big deal.
Yeah.
And then ask what happens sometimes if you have the time. Otherwise, if you're not going to give it to them and then they're allergic to it, don't worry about it. But sometimes what happens to you? I get short of breath. Like that's a little bit more concerning than what happens to you. I get an itch on my nose, right?
I also
So
like
it's
to
not
know what your
good.
blood pressure is normal.
Very good. Okay. I'm actually on blood pressure medicine, so I do take it regularly, and normally I'm about 110/70.
After your medication.
Mhm.
Did you take medication today?
What's that telling you?
That you are hypertensive, right?
Super hypertensive.
Yeah.
Why?
Probably.
Probably.
Probably pain, but
Probably.
You said your last injection you think was 8 weeks ago.
Okay.
So I mean, like
Take every piece of information from your patients with a grain of salt.
yeah,
right?
exactly. And like I said, the big thing in my mind right now is still ectopic.
Okay.
Because that to me is the thing that's going to kill you the fastest with that. Lower left quadrant pain.
That's exactly how we need to do our differentials. We need to have a healthy differential, which I like to do my students to be 5. Okay. How many differentials can we have with a woman with abdominal pain?
Look it up a bunch.
And did you ask me, could I be pregnant? Are we getting there?
Yeah.
Remember, it's chaotic in there. There was 18 of you guys in there.
So
right
for
with
me, and I don't know what your
so
thoughts are on this,
patient.
if your last menstruation was 8 weeks ago, you could be pregnant. Because the sexually active thing, people can be dishonest, they go, there's no way I'm pregnant, I'm on the pill, it's like,
Well, and sometimes
I
I
use
ask.
condoms,
I say,
even
how
an
do you
IUD.
know that you're not pregnant? And
Yeah.
they'll say, birth control. Is that 100% effective? No. They'll say I'm gonna same sex. I'm gonna be
Absolutely.
cheating and stuff. But
Yeah,
sometimes
totally.
I just say, well, how do you know for more information? But clearly you don't need to get that right now. Yes, there's a
Yeah, I
possibility
did
of
have a
pregnancy.
lesbian a couple months ago.
So-
I asked, 'cause I was like,
Well, probably not, but I mean, it's safe to ask. And do we,
And they
as a
could-
couple, do I
yeah.
still have to pee in a damn cup? Even though
and
I'm
you
not
could
pregnant?
be trying to have in vitro or something, there could be other.
Which leads you to this patient. So what's our differential right now? Number 1, you have ectopic.
Ectopic.
What do you got number 2?
Could be something.
You need 5.
5. Well, I threw a topic out there, and I'm the only one talking. So it's
Okay.
very guys in here.
Pancreatitis, why? And where is it on your list? Okay. Are we working with 5 right now, or we're working with 10?
Kidney stones.
Very good.
Yeah, that's why I asked.
You already asked kidney stones.
Are we working with 5 or 10?
5 or
What do you
10
guys
differentials?
want? Yeah, what do you want?
5.
5.
My brain
okay.
is small.
So, okay, so we already have the ectopic, which is number 1. You throw out pancreatitis, where do you want it to be? 5 or off the list?
Well, that would be on there 4 or 5.
Okay, 4 or 5. You threw out kidney stones, where do you want that? 3? who's in the number 2 spot?
Cysts.
Yeah, so still very
Sure.
cyst.
Everything that goes along with it, like an actual cyst, which sucks. What else can
Cyst
cysts do to
rupture,
you?
it can also rupture.
They can rupture,
So
they suck.
I want to check for fever, that kind of thing too.
Okay, so we have to gather, right? Once we build our differential, we're not done. We have to constantly cycle those, and then having build our treatment algorithms and our assessments, we based on basically those 1 and 2, which is your ectopic and whatever else that you kind of want to work with. So let's work on the pancreatitis, maybe get rid of that.
Or it's like some type of gas.
Well, we want to check for
Okay.
valve
Sure,
obstruction.
I'm 99.
That's why I was like, not even going.
But back to the treatment, you have a line in here, are you giving me fluids?
No, I mean, at this point, you're, well, your tachycardia blood pressure size, you're compensating, start of line.
What does my skin look like?
You were pale? Yeah.
Pale gives you everything,
Yeah.
man. Pressure is an illusion sometimes.
Yep.
Right?
You're compensating. so-
I am fucking in pain. So my pain tolerance.
I also like
is
managing your pain and seeing if that helps with that. blood
100%.
pressure.
So, fluid, yes or no?
Yeah.
Yes. What are you gonna give me? 37-year-old female. How much?
I feel like 500.
Wonderful.
Yeah.
Okay. What else are you doing? Treatment. We've done Zofran. How much? 4. Okay. Before or after your pain meds, how do you guys give it? Or do you care? I like to give it before.
Just to manage if they get nausea from it, yeah.
Because especially if you're gonna follow it with that fucking terrible drug morphine.
I have
like to give it
once
first.
that would make so like put them in the
It
same.
makes them in the hospital, as
Yeah.
long as your protocols, sometimes your protocols have to speak to it, but do you guys know who like the pharmacist is around here that kind of oversees some of your protocols with your medical director? I'm hospital based, so I have that. So it's potential that you guys don't have that, but I have access to a pharmacist, so I asked him one time, because you guys ever get a B52?
No, okay, I'm familiar with it. We know that.
So a B52 writes 3 medications and a lot of medicines together. And I was told by our pharmacist that kind of oversees some of our protocols, never mix Ativan with anything, it doesn't play well. So mix the Haldol and Benadryl, but then also keep the Ativan separate and you gotta dart it twice. Is it fun darting a psychotic person twice?
Yes.
No. So, people wanna mix it. I'm sorry. Does it bring you pleasure? Does it bring you pleasure is a different question. So anyways, off topic here, but, so yes, I give the Zofran first. And then 4. Fentanyl, how much do you give me?
You said you're 37, I figure out your weight, you know.
Oh, wait, 160.
160, okay. I like to divide by 2, take off 10%, so 70 is like nice, 75.
And do you literally pull up 70? Are you too?
No, so I like to actually squirt 2 out of a flush, 10 ml flush, drop, because we're 102. So then I have 100 and a 10 ml flush, so I know that I'm 10 micrograms per. So that's a faster way for me to do that.
You're an idiot, smart.
It is more
I just like
idiot.
follow that and then I got lost.
Well, that way, like, I want to get 70, just give me 70 mils, and then I still have everything else.
But do you give the 70? Most of us, I think, give increments because it's easier, right? 25, 50.
Oh, I see what
100.
you're saying.
But you do literally follow the
I
1
would,
microgram
yeah.
per. Totally fine. It's just
How close?
I mean, I
it's just
found.
extra math.
How close is Chief working on right now?
I haven't seen the.
She's not right.
Okay.
You're 37, I feel like you're. Yeah.
Just always in the back of your head, remember you can always give more.
You can't take
Whether
it.
or not
Well,
you
you-
chart it or you chart it.
Yeah.
But, well, you don't
You
want
can always take it
to.
away.
You don't want to. That's a chart that goes right into the UI. But yeah, you can never take one. You can always give more.
Yeah.
And you never know how somebody is. The other group didn't ask me if I took anything for my own pain before.
Yeah.
Because I am a chronic pain patient, so I have access to Tramadol and Vicodin. I may have medicated myself before you guys got there. You never know, right? Anytime you're going to give a med that maybe someone has tried to self-medicate, we always have to be careful with that, okay? Okay, so fentanyl, Zofran, I'm in the back of the ambulance. All of a sudden, I feel better. My color returns
I'm
for
worried
just
about.
a second.
Oh, sure.
Okay. So what will you predict if you're still kind of hanging in that
We are fucking
ectopic?
code free right now.
Okay.
We've been.
Any other differentials that you are? I mean, you're in
I
kill
mean, so
zone right now.
it's left
so-
side, so I'm not too worried about appendix.
And did you ask me in the chaoticness in there if I had all that weddings?
No.
I don't remember if I heard it. It was the other group too. But remember too, when you guys come with such a presence that it's overwhelming for patients sometimes. They don't. And I had my head down and I'm in pain. So I kind of heard little things here and there. Your way of questioning is totally fine, just make sure that you get everything that you have asked for, because the patient kind of can get lost in a little bit of your group assessment, right? If you ask me if I had all my organs, which is incredibly important, I would tell you, yes, I have them all. Does that do anything too different?
Nope, doesn't mean anything. I mean, yeah.
You can put it lower on the list if you want to. You can arrange, right? We're constantly rearranging that differential. Okay? 2 or 3 miles down the road, my collar goes bad again, and I feel very sick. I feel very nauseous, and I feel very dizzy. Repeat vitals show that I have a pressure of 90 over 50 now.
Oh, yeah.
What's happened?
You've got a rupture.
Yes. And I don't want to lay back. I want to sit completely up, straight up. What does that tell you? I don't even like this. I want to sit almost with my feet up here like a CHF.
You're gonna hold tamponade on that, or?
I originally liked to hold it there. I feel like I don't have pinpoint pain anymore. I have generalized
Visceral,
abdominal pain,
Yeah.
visceral pain. What has anatomically or physically happened to me just now?
You went from guarding to.
And why did I say I had a release of pain?
Because it ruptured, you had pressure building
That
and ruptured,
pressure
so
pain, it
now,
ruptured.
but you've ruptured into your abdominal cavity, so that's
So where's that blood gone?
into your peritoneal space.
It's gone everywhere.
Yeah.
To the point where it was touching my diaphragm. I lost 500 in that time between, and did I take an ambulance? No, my friend drove me, okay? So in the time between when my friend drove me to the hospital from here to Carson, how long? 110 miles an hour, how long would it take me?
Where are you from? From
110.
Oh, from Val?
No, literally I was at that place where I told you doing my
Oh,
training.
that's pretty
to
far south, so
Carson
you're still
College.
talking 6 minutes.
Literally she drove 110.
Yeah.
So in that time period, I lost about a half a liter of blood, right? Because I felt a little bit better as soon as we pulled out, and I'm like, oh, turn around, I feel good. She's like looking at me, and I'm still this color, and she's like, I thought we are, right? So all that blood, 500 liters, was irritating my diaphragm to the part where I didn't want to lay back. Why do people with spleen injuries have that referred left pain?
Pressure on the nerve.
Yes, the phrenic nerve. I was getting pressure there, so it was like I was acting almost like a splenic rupture because I had so much blood around it. Okay, so I was pale as crap. Now, you heard that, you know what's going on. What else are you gonna do or say or assess, or how are we gonna finish me out before you bring me to the hospital? You upgraded to code 3, or did you start out with 3?
I would have started going through.
I would have too.
Sorry, I kind of got distracted. So you were saying what else would I look for other than the
Look for, do, prepare. I'm just saying I had referred pain.
Yeah.
And all those signs and symptoms, I mean, clearly I didn't have to bust my spleen unless we totally were misguided on my assessment. I wasn't a random trauma.
Yeah.
But you're kind of putting all the pieces together now.
Yeah.
So what else are we doing for me, if anything?
Well, we should do EKG.
Sure.
Yeah. I mean, we could ultrasound.
I'm good to go.
Yeah.
EKG's good to go, sinus tap.
We
Start
wanna just-
110.
Hey, did you palpate and stuff already?
Yes.
Way earlier?
Well, we would have done it.
It was a limited exam. It's hard to do an abdominal exam
On
on
somebody who's
somebody
like that.
who is guarding. So then we have to be like, well, what are we gonna do? Are we gonna physically like try to pry them apart to get an assessment? No, we're going to. We're gonna medicate them a little bit and do our best? Probably. The best way to get an abdominal exam is not me sitting on the toilet. It's to kind of, that's actually someone laying almost perfectly flat.
Yeah.
You can get a lot of good assessments done there, but I'm not gonna do that for you. So this way would be
But
good.
after getting the
you know,
you might get a chance.
you might not. Okay, so try to get what you can from the assessment, like right around when you're delivering your narcotics and your Zofran. My sats dropped a little bit too. So not only did you give me narcotics and Zofran.
But we gotta keep
an eye on
our
the
protocol
sat.
with narcotics is to do end-tidal monitoring too,
Should
so
be,
that way
wonderful.
you can monitor rate and obviously
Right. See if I stop.
too. So yeah, if there's any change, and then you already have the handgun in place, you're like, oh, no, what do you do?
Okay, so I'm 96, but in the back of your mind, 96, right? And textbooks are fine, but in the back of your mind, you also know
Your
that my
internal
oxygen carrying capacity is now flooded of my abdomen. So I would put me on some oxygen. 2 would be lovely.
You can be your own day. We'll just.
Yeah, that was. But I took myself in a private car, right?
Well,
That was not
healthcare
good.
workers are the worst.
Exploring a little bit more about my medical history too, as you kind of clean up your assessment on the way. So other things that probably would still just be pieces to your puzzle, cluing in on what's going on with me. You asked me about my history. So yes, I've had kidney stones. Yes, I've had ectopics before that did not rupture. I've also had 2 miscarriages and the ovarian torsion that I had the surgery for. Obviously, had you lifted up my shirt, you would see that belly button scar and that lap scar that I have on either side. You know, and you'd have been like, ooh, what's that from? Well, that was from when I had an ovarian torsion, when the cyst was the size of a softball, twisted my ovary, but the doctor went in and saved the ovary. So if you hear like a story of like, oh, the woman had an ovarian torsion, had to have surgery for it, what do you think probably had happened? You probably lost the tube. It's called an oophorectomy. It's my favorite word of all time because there's so many O's in it. And that would kind of clue you in, can you have an ectopic without a tube? Like if you got no tube over here catching the egg, you can on this side. Yeah. So like that could have been a clue, right? Like yes, I don't have a tube on that side, so what's the pain about, right? So it's just like little pieces of information. And I said yes to a lot of the medical history that you started with, so I think you knew you had a problem with me right away, right?
Yeah.
Because I'm like, oh, I have lots of problems. And then you're like, hey, have you have a history of this? Yes.
I mean, any female, especially lower abdominal pain, it's like,
totally. And do you?
Age, so I'm 8 years old.
Yeah, absolutely. Do you guys need to know the absolute diagnosis for me to treat you?
Negative.
Not even close.
Especially that. It's not
No. You can have an idea, right? Sign here for my separate bill. So, but the differentials are huge. I wanted to make sure that you guys were good with your female differentials, that you're gathering all the things that you need to gather, and all of you have hit the key things, that you are treating along the way, right? I was hoping no one would leave me in the bathroom or force me to get up. I mean, all of your affect, this whole group, and the other group was wonderful. I very much appreciate that. And just getting that good medical history, making, you're figuring out what your diagnosis is on top, and if it's, something that's going to kill your patient, act appropriately.
And most of us in this department are of the mind, you're not going to stay and play with any patient who appears critical. Like
totally.
The signs you're giving off is like, even if you have to finish questioning or never finish, a line of questioning is getting to the hospital.
It's almost like a trauma
on the
assessment,
ground.
right?
Totally.
You might not get to your secondary.
Yeah.
But what do I need? And you deduce that from looking at me.
And I could tell, like,
You're a
even,
trauma surgeon.
I wouldn't even wait for a blood pressure on because I could tell, like, the pressure sucks.
The only thing you had to do with me, and probably me specific as a patient, is just make sure you're not kidnapping me.
Yeah.
I was very headstrong,
Yeah.
right? And I'm just like, no, I don't.
And that's how you gotta build that part, like-
No, can you just put me? I told the other group, I said, can you just put me in my friend's car and just let me go? And they were like, on what fucking planet, right? But they said it nicer, But just make sure you know something's wrong, right? You know it's an emergency. Just make sure we're not swooping too bad to where a patient's like, holy fuck. I called you just to evaluate me. And you're like, you're having a STEMI. You can just sit here and stop talking. Anything else? Questions, comments, concerns, good things, bad things?
He's going to be endometriosis.
Endometriosis, yes.
There we go. That's it.
I have it.
That's an option.
Put it on the differential. It doesn't necessarily act the way I was acting.
That's
But that's not going to be top.
But put it there.
I mean, it's painful, but
Once you have a couple in your differential that can actually kill your patient, the rest, they should be there to finish to complete your assessment. You never want to just cut yourself off because I know what it is. Finish your assessment. Make sure you gather all things. But yeah, once you have a killer on your list, like MI or things, PE, AAA, ectopic, once you have a killer, focus in and fix that. And do your best to outrun what the patient's trying to do. Anything else? Was it a good job of memory, or you guys seemed pretty good, pretty chill with it. Okay. Well, you treated appropriately. I like your assessment. I like your thought process. Everything was good. You guys got any?
no.
All right.
Billy eyes, full
Finish.
questions.
It's not gonna last forever.
Yeah, that's my drive.
Oh, you're welcome. Okay.
Right.
And you guys got your good little GI talk in there. Have you guys ever seen a gripworm GI? Discussing the area. Have you guys seen a varices? Have you seen them laid out in front of you and die?
No, I got it.
No? So we got a call for vomiting blood, right, to a gentleman out in Fallon. He had his house locked up and 3 pickles. By the time my partner and I get Stephanie, who I teach at the college with. His house was locked. We could see him in his house. He was sitting in front of his dark blender in a white t-shirt with blood all the way down, with his 3 pit bulls sitting around him and like aggressively glaring at us, right, when we looked in, and we couldn't get in, and we just saw him bleed out. He was a full-on code when we got into his house within like 5 minutes, because we had the sheriff department get the dogs.